Hello and welcome to Health Live at Seniors Today. I hope you like this video. It's a little long, but we thought we've been around for almost 2 years, but it will be 2 years in June. And it's a good introduction. Thank you, Devendra Gada, for your comments. And we are delighted to have here with us Dr. Ankur Phatarpekar. Good evening, Dr. Ankur.
Yeah, hi, good evening. How are you?
I'm fine, thank you. So Dr. Ankur came in a little late because he was in the OT with an emergency case. It's unfortunate that we have to pull you out from your patient, and this is happening just too often. Perhaps we should look at a better time to do this.
No, it's my pleasure to be with you. And emergencies don't give a time. That's the problem. I mean, they come. They are emergencies, right?
That's right.
So that's the problem. I was wondering. I mean, whether I'll be able to join you because the procedure was getting delayed. But thankfully, I finished it in nick of time, and I'm here with you.
Great. So let me do the introductions first. We have here with us Dr. Ankur Phatarpekar, who's an interventional cardiologist at the Saifee Hospital and a director of Cath Lab at the Symbiosis Hospital. He's an alumnus of the Seth GS Medical College, which of course means that he was quite a topper in his studies. He has performed more than 300 PCI procedures as primary operator, including 50 primary angioplasties in myocardial infarction. He has considerable experience in managing chronic total occlusions and use of intravascular ultrasonography. He has attended workshops on OCT in coronary arteries under a well-known doctor. He has more than 100 different kind of surgeries, exceedingly long names, so I'm not going to be able to pronounce them. He has a special interest in structural performed and assisted in complex structural heart disease procedures like device closure of ruptured sinus of Valsalva, etc., etc. He's also active in the upcoming field of oncocardiology, having experience of treating a special subset of oncology, that is cancer patients with long-term cardiac issues due to chemotherapy. Welcome to Health Live, Dr. Ankur.
Yeah. Thank you very much. And so nice of you. I mean, I'm very happy to be here. Because it's a pleasure to come and speak with senior citizens who have given so much to the society and will be giving so much to the society with their experience. And I'll do my bit to share my knowledge with you, so that if it can help you, we'll be very happy.
No, we will. We've heard so much about you and the work that you all have been doing. That it's a pleasure to have you with us. This is a question which I ask everybody who comes here. And since you were in the OT just now, you are in hospital gear, as I can see. What's the COVID situation like right now?
So thankfully, the COVID situation is improving. We are not seeing many admissions. We're not seeing as many bad patients as we used to see them. And the thing is, even our routine patients, for me as a cardiologist, the issues would be that patients with COVID would present with heart attacks. And that would be very common presentation, for a cardiologist seeing. So suddenly the plaques would go unstable in the heart, cholesterol blockages, and they would rupture and would cause massive heart attacks in many of these patients. And thankfully, we are not seeing that because COVID is on a wane right now. And the problem used to happen is whenever the patient used to be COVID positive, the hospitals and the Cath lab staff would be in PPE and a lot of protocols to be followed. So a lot of time delay used to happen to treat these patients. So thankfully now that because COVID has gone down, we're seeing less and less of patients coming with heart disease and COVID. And thankfully, I think it's on the wane, and thank God. So the situation seems better now than before.
But you've mentioned you use the phrase "on the wane," which means it's not totally eliminated. And of course, the numbers say that.
Right. So the thing is, because our vaccination rates are very good, we are seeing infections, no doubt, but those infections are are still not, those serious ones. But we have unfortunately many people who are left out of the vaccination drive, either willingly or unwillingly. And because of that, what we're seeing is we're seeing the unvaccinated patients coming to the hospital with serious infections. So my appeal to everyone, and including all the senior citizens, is to get themselves vaccinated, because there is this dogma, or there is this misconception that people who have heart disease should not be taking vaccines, or they require a special certification for that. Let me tell you, people who have heart disease require the vaccine the most, because many of them would be at increased chance of having a COVID infection, and also they might have comorbidities like diabetes, which puts them at an increased risk of having COVID infections. So my appeal to everyone is to mask up, to take all precautions, and to take vaccination, and also booster now if they have not taken it.
Great, doctor. Do you have a presentation, or would you like to just give just speak about the subject, and then we can go ahead and take questions?
I think it would be better if the audience asks their questions, their doubts, and then I could.
So just a few opening remarks from you, and then we can get on to on what the topic that we have for you is on heart valve and other cardiac concerns, special cardiac concerns for seniors. Right. So could you talk to us a little about what the heart valve is all about, and what it means to take care to ensure that one doesn't have a problem regarding that?
Right. So heart basically is nothing but a pump. So what heart does is it pumps blood from the lungs. The blood comes to the heart, and heart acts as a pump, and it allows the oxygenated blood to go to all parts of your body. And there are 4 walls in the heart. So there are 4 chambers and 4 walls. Right side has 2 chambers. Every chamber has a wall beneath, and the wall opens only in one direction. So the blood flows from chamber 1 to chamber 2, but doesn't come back to chamber 1, because it's like a one-sided wall, like any door which would open one side, or the wall of a cycle which would only open one side and wouldn't go on. So what happens is, from one chamber to the other chamber, that's the right side of the heart, the deoxygenated blood or the bad blood goes to the lungs to get oxygenated, then comes to the left side. And again, the third and the fourth chamber of the heart on the left side has its own wall. Now, what happens is, when you age, as you get cataract, as you get arthritis, as you get, the other degenerative diseases, part of the aging, the walls also undergo aging. And what happens to the walls is they become thickened and calcified. And many of our patients who are, especially now, because of good medical care, we are living longer. So many of our patients are the nonagenarians, the octogenarians, the septuagenarians. They come with either wall leakage or wall stenosis. That means there is obstruction to the outflow from the heart. So these are the valvular problems which we might face as we age. Unfortunately, we don't have great medications at present, at this point of time, to arrest this process. Though there are medications, good medications for decreasing the blockages from the heart, but they are still not good medications for reversing these degenerative changes which are set in the walls of the heart. So that's one thing which I want to impress upon, is to have a regular follow-up with the cardiologist. Respect the symptoms of breathlessness, chest pain, or syncope, which is chakkar, or blackening in front of your eyes. So these are the symptoms. The symptoms of valvular heart disease are very similar to those of blockages, and it might be difficult to differentiate. So a good consultation with a cardiologist, a regular ECG and 2D echo would pick up most of the valvular issues.
Right. Thank you. Those of you who have questions, please put them in the Q&A tab. Mention your age and gender, so that Dr. Ankur would be able to give a better answer. All right. So we have a question from Mr. Bharat Mehta, who says, after angioplasty, his doctor has given him medicine for hypertension, blood thinner, cholesterol lowering, etc. What are the side effects, and how much time precautions need to be taken?
So he's asking about post angioplasty. So let me broaden this question. So let me put the question and let me answer it myself. So post angioplasty, what are the things what you need to do so that you come to know that you're in a good shape, and secondly, so that you don't have disease further. So these are two different aims. These are two different issues. So when a patient comes to us as a cardiologist post angioplasty, asks us two questions essentially. One is how I am, and two is what should I do so that I don't have disease. So these are two separate questions. So how I am is basically we do an ECG or 2D echo, and also sometimes we make the patient to undergo a stress test because the baseline ECG might be normal, the baseline 2D echo might be normal. So you go further and put the heart under stress. So these are the tools by which you come to know that how the patient is doing heart-wise. That's the first thing. So how I am is by these three or four investigations. The next question is, what should I do so that I don't have disease? So you need to keep your heart rate under control. The first thing, there are 4 targets essentially what you need to achieve post angioplasty. First is keep your heart rate under control. That is between 60 to 80. So when your heart rate is between 60 to 80, your heart is functioning optimally. Second, keep your blood pressure at 130/80 unless you are 80 plus. So if you are having a heart disease, your targets are not 140/90. Your targets are 130/80. Because there is data to tell you that when you bring the pressure below by 10 mm, you live longer. The third is your cholesterol. And if you see any cholesterol report, there is a lot of cholesterol, types of cholesterol, the LDL, the HDL, the triglycerides, of which the most deadly or the most the cholesterol which correlates with heart disease is the LDL cholesterol, which is called as bad cholesterol. So the LDL cholesterol has to be around 50 mgdl. So what people do is they do their cholesterol reports and see the reference range and say, oh, my cholesterol is within the range, so I'm okay. But mind you, those ranges are for general population. It's not for patients who have cardiac disease. In cardiac disease, we keep the LDL cholesterol way too low. That is, we keep normal range would be 100 mgdl. We go to 50 mgdl. That is half of what it is. And lastly, the fourth and the most important goal is if you are a diabetic, keep your HbA1c or your sugar, 3-month sugar at around 7. So when you keep your HbA1c 7, you keep your heart disease under control. So heart rate between 60 to 80, BP 130/80, LDL cholesterol of 50, and your HbA1c of 7. So these are the 4 targets. When you achieve this, you reduce the chances of having further cardiac disease. Now the question was, I'm taking medications and what are the side effects of medications? So normally post angioplasty, you are on 2 thinners at least for a year, unless you are a very elderly gentleman or a lady. In that case, we would give thinners for 6 months depending on the bleeding risk, and then switch over to a single blood thinner. The problem is when you have thinners going on, you should take care that you don't have a fall or a trauma, because that means that you will bleed more. Second is you might be on cholesterol lowering medicines, that is statins, atorvastatin, rosuvastatin. These medications are very good for the heart, but they might cause side effects like muscle aches and pains. So severe muscle aches and pains are found in certain individuals. So if at all you're on statins or cholesterol lowering medications and you're getting muscle aches and pains, you should visit your doctor to evaluate and to get investigated.
Great. Thank you, Doctor. There is a question from Mr. Somesh Java, who says, I'm 67-year-old male patient of HOCM. I'm highly symptomatic. My doctor has advised me septal myectomy. I've been told that there is no center of excellence in India. I had met some consultant in the US during my recent visit. Was told that the surgery may be carried out by a surgeon who performs 20 to 40 surgeries annually. I was advised to get the surgery done in the US at Mayo and Cleveland were the names that came up, but the expenses are unaffordable by me. I'm presently getting myself examined at PGI Chandigarh, and I am on ethanol 50 mg and atorvastatin 20 mg, both OD. Please advise if any center of excellence. Sorry. Please advise if any center of excellence is there in India, and also advise how risky is the surgery and what is the mortality rate.
Okay, so let me tell you what HOCM is so that our other listeners could understand what HOCM is. HOCM means hypertrophic obstructive cardiomyopathy. That means your heart has become big. So you will find this in a lot of individuals having blood pressure, having heart big, but this is a different condition. It might be genetic or congenital. In that case, your heart becomes big, but it's not only big, but it also causes obstruction to the outflow of the heart. So what happens is there is a resistance to the blood flow out of the heart because the heart has become so big. And because of that, you get symptoms like breathlessness or chest pain. And the way to go about this is taking atenolol. So you can also maximize the medical management in terms of heart rate. If your heart, you can go for the 50 atenolol dose is quite low for HOCM unless your heart rate is below 50. So you could go higher up on the atenolol dose, and that could help you in decreasing your symptoms even further. Now the question is, which are these, and there are newer drugs which are coming in. There is a new drug which is coming, which is there in the US. It is going to get anytime a US FDA approval. We might find it that within a few months it might also come to India. So that's one hope as well. But in India there are centers like Jaydeva. In Jaydeva there's a center in Bangalore, as well as Narayan Hrudayalaya. These are the centers which are doing myomectomy, but the numbers are not as big as those are there in the US. So Mayo is one big center for myomectomy. There are certain centers in Germany as well who do surgical myomectomies on a regular basis. So if if he is interested, I could share my number and we could get in touch and I could help him out.
Yeah, thank you very much. We will take it, and we will also put it up in the takeaways that we carry on Monday. Brigadier Kalia has asked, Doctor, can you once again repeat the cholesterol levels for a person who's 75?
So what I said was 50 LDL cholesterol for somebody who's already had a heart disease. So a person who's had an angioplasty, you need to keep the LDL cholesterol of 50 or less than 50. And for someone who's a diabetic, so diabetes is one different subset. So in diabetics, what usually happens is we keep on focusing on the cholesterol, on the sugar, but cholesterol is like a stepbrother. We don't check the cholesterol at all. But all the problems of diabetes are because of high sugar and cholesterol. So you have the blockages in the heart or the kidney getting damaged. So you also need to check your cholesterol. So every diabetic has to check his cholesterol. And in a diabetic, the cholesterol, LDL cholesterol should be less than 70.
Right.
So 50 for heart disease, 70 for a diabetic patient.
Right. Thank you. There's a question from Mr. Shrikant Kulkarni. Can recalcification be reversed? If so, how?
Okay. So what he's asking essentially is calcium. What happens is when you get blockages or when you get degeneration, is calcium gets deposited. So you would find you doing a CT angio or you doing an echo and doctors writing there's severe calcification or moderate calcification present. So let me tell you, people have this misconception that because they're taking calcium tablets, they're getting more calcium. So that's not the thing. What happens is when your body tissues degenerate, they take along salts along with it. So calcium gets deposited as a part of degeneration. So it's a marker of degeneration. So that's one thing. Secondly, in coronary artery disease, when you have blockages, you can get a lot of calcium in your coronary arteries. So what you can do is, there are studies to prove when you give statins, high-dose statins, that is cholesterol-lowering medicines, these blockages or this calcification can be arrested. Now, whether they can be reversed is a question. We wouldn't be able to answer completely. But yes, they could be arrested and they could be kept under control. So calcification in coronary arteries can be arrested.
Right. Thank you. We have a question from an anonymous attendee who's age 68, and she has asked, I would like to know what is cardiomegaly. I need to get a surgery next week for my eye. Is there any risk?
Okay, cardiomegaly, as the word says, cardio means heart, megaly means big, so it means a big heart. So big heart could be due to a number of reasons. So it could be maybe blood pressure, it could be valvular issues, it could be multiple things. But most commonly, and if the lady is asymptomatic, most commonly it's poorly controlled blood pressure. So if the blood pressure is not under control, your heart becomes big. Now, why does this happen? So what happens is your BP, your heart has to pump against your blood pressure. So if your blood pressure is just 120/80, your heart takes minimal effort to pump. Now, same thing when the blood pressure goes to 150, 60, 170, 200, the heart has to generate that kind of force to get the blood ejected out from your system against the BP. So what happens is there's a physiological hypertrophy that the heart becomes big. And because it becomes big, it's just like going to the gym and lifting weights, your muscles get developed. The same way the blood pressure, your heart becomes big to compensate for the force. And because of that, what happens is the heart becomes big, it ejects the blood, but it becomes more stiff as well. It's like Salman Khan walking with all the muscles, he's all stiff, he cannot dance well, right? So because the heart becomes stiff, what happens is it doesn't receive the blood well from the lungs, and therefore you feel breathless. So this is the problem with big hearts, and especially in patients who are hypertensive, who are poorly controlled hypertensive or poorly controlled blood pressure. Now she's asking whether it's a risk. I think if she's got a cardiomegaly, she should first get an ECG done and a 2D echo done and a consultation with a physician or a cardiologist, and then take it forward. Because if it's an eye surgery, it's not an emergent surgery. Maybe it can first let's get the heart evaluated, and then she could go for the surgery.
Doctor, there are a couple of people who have asked for your coordinates, your number, and your email address. Would you be able to share that just now, or so we can,
Should I tell you right now?
Yes, please. And I'll also put it up on the chat.
My contact number is 98203.
1 second, sir. 1 second. 98203.
84743.
84743.
And my email ID would be Dr Ankur MD. That is DRANKUR MD@gmail.com.
Great, thank you. So, doctor, just on a lighter note, there's a lot of people say "bade dil wala hai," So obviously that's medically not the right thing to say.
No, absolutely not.
Absolutely not. Okay. It was just getting too serious and too being a practice joke. So there's another person who said, there's an anonymous attendee who's sent a lot of questions. If you can send it as one question, it will be great, but I'll in the meantime take something else. So there's a question by Somnath Gupta who says, my wife, age 33, heart is weak as per diagnosis and found HDL 42 and LDL 67. She is diabetic since 15 years and HbA1c is 8.5. She is still using tablets for diabetes. What should be the ideal level for cholesterol?
So what I got from the question is the heart is weak. The diabetes HbA1c is 8.5. So I told you the cutoff is 7. So that means the diabetes is not in a good control. And I've not got the LDL cholesterol. Has he mentioned the LDL cholesterol?
LDL is 67.
67 is pretty okay. I mean, it should be 50, but 67 is okay. So the way to go about is first, why is the heart weak? Okay, so essentially 3 causes why heart goes weak. One is if there is a blockage in the heart. So the blood supply to the muscles of the heart goes down, so heart pumps less. Second is if there's no blockage, but the heart muscle by itself goes weak. So that's called as cardiomyopathy. So your heart muscle goes weak and therefore the pumping goes down. So there's no blockage. And the third thing is like COVID or all infiltrative diseases like infections and inflammation, they affect your heart. And because of that, the muscles get stiff and they don't pump. And that's the third reason. So blockage, muscles going weak, or infiltration or infection in the heart. So these are the 3 reasons. What I suspect is she's a diabetic. So the most common cause of in 90% of diabetics, the pumping goes down is because of blockage. So if there's a blockage, that needs to be treated first. And then you need to manage your diabetes better. So there are fantastic medications now available for diabetes. And many medicines which are available for diabetes are very good for the heart. If at all by maximum medical management also, or by medicines also, your sugar does not come under control, then she has to be on insulin. So the end point is not how much medicines you're taking. The end point is what is your HbA1c. If your HbA1c is 7, with 2 drugs, we are happy. But if it's not even with 6 odd drugs, then you have to be on an insulin.
Right. Doctor, there's a question which has come in. My HbA1c is 6.2 and sugar levels are under control, but my LDL is 127 and non-HDL is 152.9. What should I be doing?
So what I get is the patient. This person is the listener is not a diabetic, because the HbA1c is the listener a diabetic? Is the question regarding diabetes or non-diabetes?
No, about the LDL count.
About the LDL. So 121 is slightly high. So what are the four groups of patients? So who requires aggressive cholesterol control? So one is, if you have a heart disease, you require aggressive cholesterol control. Second is, if you're a diabetic, you require aggressive blood pressure control. The third is, even if you are none of them, but your risk is very high of having an event. So that in that case, you would require a better cholesterol control. In this patient, the ideal cholesterol is 121, which is high, which is more than 100. But if he has a very strong family history of heart disease, and if he's at a very high risk of having a cardiac issue, if he's a smoker, then we would be happy to keep it less than 100. So he could first try a diet and exercise, and then if at all by that also, if it doesn't come under control, then maybe a low dose statins.
Right. Thank you. There's a question by the name of there's a question from Raghavendra Odiar, who says, I find doing regular pranayam keeps my heart health in sound condition. Do you agree with this view?
100%. 100%.
And what about Panchakarma? What are your views on Ayurvedic treatment?
So I'm sorry, I'm not an expert in Ayurvedic treatment, so I'll be incompetent to tell anything. So I know only heart and that too, modern medicine. So I wouldn't be in any position. What I tell my patients who ask me whether should I take Ayurvedic medicines, I say, you don't stop my medicines. Whatever belief you have, if they are safe and your doctor says, they go ahead, then go ahead. I have no issues with it. But please don't stop my medicines. But I seriously, I am not competent enough to talk about Ayurveda. But the regular exercises and yoga definitely helps. Biofeedback, relaxation therapies, these are part of our rehab, the cardiac rehab we talk of. Angioplasty is just one part. Prevention is the second part, and third part is rehabilitation. So rehab, yoga, exercise is a very essential part of cardiac rehab.
Right, thank you. We have a question from Mr. Suresh Ghate, who's 69. In my case, he says there's severe aortic valve calcification and aortic stenosis. There's mild AR and AO is 3.1 centimeters. The LVEF is 65%. Is valve replacement necessary, or with all precautions can be reversed? I have reduced weight by 25 kilos, that is reduced from 100 to 75. It is more than 1 year and I'm taking precautions.
What is his age?
69.
69. So as I told in the opening remarks, valvular heart disease are part of aging. Unfortunately, we have, as we discussed, statins, diabetic medications. These reverse your blockages of the heart. But there's no good medicine. Trial after trial has shown us that there's no good medicine to reverse the valvular issues. So if you have severe aortic stenosis, and there is data now to tell if the severe aortic stenosis, when treated early, helps in improving the long-term outcomes. So if you're a near 70-year-old, valve replacement is one thing, and the other thing which we do, and I do regularly, is transcatheter aortic valve. This is a revolutionary therapy which has come in. We've been doing it since 2017. And what was initially in octogenarians, nonagenarians, there was only open heart surgery for the valve. There was nothing like an angioplasty for the valve. So this is like an angioplasty of the valve. So what you do is, from the leg arteries, you take a valve crimped on the balloon, and you take it across the valve and just open the balloon from outside. When you open the balloon, the valve expands, and you get a new valve functioning without a cut in your chest. And believe me, I have discharged patients in 24 hours post this valve therapy, which is called as TAVI. So if you want any information, you can go to the valveclinic.org, which is our website, and you could go there and you can check out the videos and this therapy.
Right, thank you. We have a question from a male 70 to 72. I don't know why he's given a range, but whatever. 70 to 72 years, had a stent operation in 2018 and has been told to take EcoSprin 75 all his life and Rosaville 5 mg. Does he also have to take all this all his life?
As I told you that rosuvastatin 5 is a very low dose. So what do we do? How do we check post angioplasty? You check the LDL cholesterol. So again, the endpoint is not 5, 10, 20. Why a 5? Why a 10? Why a 20? Why a 40 in an individual? It doesn't depend on the dosage. It depends on what your LDL cholesterol is. So 5 is a very underdosed medicine going on. Second is aspirin. You have to give one because it is put in a stent. So whenever a stent is there, you always have a small risk of the stent getting blocked because of a clot. And therefore, aspirin has to be given lifelong. The only risk with that aspirin is the theoretical risk of having a bleed. But here, whenever you do any therapy, it's always risk-benefit ratio. So here, the benefit is much, much more than the risk. So yes, the answer is you need to be on an aspirin all your life. And rosuvastatin, I think you should consult your cardiologist and check your cholesterol levels, and you need to titrate your dose.
Right. There's another question for a woman 77, bradycardia and pacemaker. Does she take Elixix and Rosaville 5 mg lifelong?
So if there is a pacemaker inserted, or then there is no. So this system is totally different. There's nothing to do with the blockage of the heart. So there is an electrical wiring system of your heart. So as you have the valves, you have the arteries of the heart. You also have the electrical wiring system. The heart is a wired system. That's why you see the ECG. The voltages which are picked up from the heart is the ECG. So what happens is when certain individuals, your pacemaker or the main area which gives the beats, it goes down slow. It becomes bad, and because of that, your heart rate goes down. And because of that, you might get chest pain, breathlessness, and you might have chakkar, or you might fall down, have a blackout. So what we do is we do a small procedure. We just give a nick on the left part, just under your collarbone, and put a small device which is called as the pacemaker. 2 wires in your heart, which is again not opened up. It's through a small nick, and that gives you. It's a smart device. So what it does is it senses whether your beat is coming properly at 60 beats per minute. If it's not coming, it gives a current on its own. So that's called as a pacemaker. It's a very sophisticated machine. Now, when you have a pacemaker, ideally, if you have a blockage, then only you require to be on a statin, or if you are a diabetic, if there is an indication for starting statins, then you would be on it. Otherwise, if you have a pacemaker by itself, pacemaker is not an indication to start anything. So once you have done a pacemaker, that's it. There is no medicine for keeping the pacemaker ongoing. So whenever you have a pacemaker, you have to check your pacemaker every year, because the battery lasts for 8 to 12 years. And before the battery goes off, you need to change your pacemaker. So it is very, very important that you get an ECG on time, and every year you check your pacemaker to the pacemaker company person, the company executive.
Right. She's just sent a message that the pacemaker was inserted due to a stroke in 2015.
Right. So there is no special medicine for the pacemaker. Yes, for the stroke, whatever the stroke was due to, if it was due to blockage, then she has to be on a statin and an aspirin.
Right. Doctor, the person who spoke about the pranayam, etc., he says for future, he has no heart problems right now, but for the future, what type of food, he's a vegetarian, what type of food would you recommend? And this is for everyone in terms of vegetarian and non-vegetarian. What kind of food would you recommend, and what are the kind of indulgences that you would allow?
So what kind of food is, so if you're a hypertensive, you need to go low on the salt. So your salt needs to be restricted. But what happens is some people overdo it. That is also what I want to impress upon. Please don't overdo it. What happens is your sodiums go low, and then you get disoriented, and then many of our older patients have landed up in hospital ICUs because of that. So that's one thing. The second thing is, if you are having a weak heart, you need to take your salts low, and also the fluid should be low. So that's very, very important. So if the pumping of your heart is less than 35%, your fluid intake has to be low. Okay. People who have a normal functioning heart, there is no fluid restriction. In fact, fluid helps. Now coming to the diet, so bakery items, maida of any form, okay, your biscuits, pav, your breads, avoid that. Eat a lot of green leafy vegetables. That helps. It has a lot of fibers which help in keeping the cholesterol in the gut and prevent the absorption in the blood. Third, you need to cut down on your milk products. So I tell my patient, where does your ghee come from? Where does your cheese come from? It all comes from milk. So milk has to be taken in moderation. So what is the alternative to that? You could go and take a healthier option like a skimmed milk, which is a low fat milk. So you could do that. We have this concept of applying ghee to all rotis. Okay. So मैं तो खाता नहीं हूँ cholesterol, कुछ नहीं लेता हूँ, मैं कोई तली हुई चीज नहीं लेता हूँ, is what my patients say, but they apply a lot of ghee on their rotis. So that is one thing which you should avoid. Coming to the sham ka nashta, which is the most unhealthy of all the Indian, in the Indian diet, is the sham ka nashta. We will keep ourselves healthy throughout the day, but the sham ka nashta will be samosa, will be farsan, will be chivda, will be vada. So curtail those instincts of yours in the evening time. We could go eat fruits, have a fruit bowl in between. Okay, you could eat nuts. So these are the healthier options which you could have. And night time, have a light diet. Have a light diet. Try to eat before 9 a.m. or 9 p.m. Helps. Why? Because if you eat and go off to sleep, you'll get a lot of repurge. So early in the morning, you'll get this throat irritation, acidity, what people say. So eat. So whatever the Jains follow, they follow eating early, which is a very, very physiological and the right method. So eat early so that you have at least 3 to 4 hours before you go off to sleep. Last thing which I want to tell is avoid screen times. So what happens is in the night time, any form of screen, whether it's your tab, it's your TV, it's your phone, don't do that. Okay. And lastly, for non-vegetarians, so avoid red meats. Don't have your mutton. Avoid your mutton and all the red meats. You can have chicken. You can have healthy fish which is baked, not fried. You can have egg white. Avoid the egg yellow. Avoid prawns. Avoid shellfishes and crustaceans of any sort. So these are the things you need to avoid. The rest, you can have a sugar-free ice cream once in a while. You can have all the sugar-free options which are there around. And once in a while, everything is okay.
Doctor, you are your hospitals are in the heart of the oily food district, right? How do you manage to ward off all the attractions?
It's right. So they're all healthy joints around, unhealthy joints around. You have to keep yourself away from that.
Right. Thank you. We'll take one or two more questions. We have a question from Mr. Kamlesh Vajpayee. He says he is 68 years old. He is having BP since 4 years, 58 kilos. Average sugar is 6.75 and BP is around 130, 140 by 80. He has Telma 40 in the morning, Cilacar 10 mg in the evening. What is the function of Cilacar, he asks. I want to know. I walk around 8 kilometers for 55 minutes. He walks around 8 a.m. for 55 minutes, no apparent problems.
Fantastic, you're doing very well. Hats off. So Cilacar is basically a BP lowering medicine. It's one of the safer medicines for blood pressure. So it does not have a lot of kidney effect. It does not require a lot of potassium monitoring. Because what happens with telmisartan or Telma is your potassium can go up, your creatinine can shoot up. But Cilacar is one safe drug. You take that and you forget. So that's my favorite go-to drug when I have an elderly gentleman, because then I need not monitor. So I need not monitor the creatinine. I need not monitor the potassium. If I feel the patient is not going to come for a lot of follow-ups with me, what I do is I safely start a Cilacar. A telmisartan is a very, very good drug, an excellent blood pressure medicine, especially who have big hearts, the big hearts. So it regresses the cardiomegaly very fast. But the problem with telmisartan is it's not like, fire and forget. You need to monitor it. You need to take that medicine. You need to monitor your creatinine, your potassium. So that requires a monitoring. What I would suggest is if he's compliant, what happens is nowadays the concept is to combine both the medicines together. because the compliance improves. And once the compliance improves, the blood pressure control improves. So there are options wherein you can combine Cilacar and telmisartan together and take one drug, like Cilacar T. A Cilacar T 40-10 would be having a telmisartan and a Cilacar both together. So you need not take it, 2 times in a day. And most of these are 24 hours action. So you take once in the night, it covers for the 24 hours.
Right. There's a question from Mr. Nisar Ukaboy, who's 79, non-diabetic, no high BP, non-smoker, no alcohol. My recent angiography report showed LVEF as 60% and RCA superdominant vessel with plaque in proximal segment. Recent HbA1c is 5.8. I have been prescribed Roseway A 20 and 75. I go for a 20-minute walk 3 to 4 times a week. Doctor, what would your advice be for him? He is 79.
I think he's doing fantastic. I think there's just a small plaque in the right side, and he's taking rosuvastatin 20 mg, which is fantastic. I think he did not do anything more.
Great, thank you. We have another question from a 71-year-old.
Could you repeat? I couldn't hear.
Yeah, we have another question from a 71-year-old male. He's had his aortic valve replacement surgery in 2013 in Mumbai, and he had to opt for a tissue valve. He's doing fine now, but was told that the tissue wears out over the years. Please advise on the same. That's his question. And what precautions to be taken? I'm taking the following medications: Envas 5, Prolomet XL 25, EcoSprint 75, Cilacar 10, and Rosewes 5.
So he's opted for a tissue valve, which is a very good thing. So this would be the question. Whenever somebody undergoes a valve replacement, so there are 2 questions asked. Now there are 3 questions, but 2 questions asked. Which valve do you want to go for? A metallic valve or a tissue valve? So what's the advantage of a metallic valve and what's the advantage of a tissue valve? Let me brief you. So metal valve, what happens is it has durability. You put the valve and it works for 20-25 years. But the problem is you have to take blood thinners, and heavy dose blood thinners. You need to keep your blood 2.5 to 3 times thinner than what is general population. So that becomes a risk when you age. You have the chance of increased bleeding risk. So what people do is they opt for a tissue valve, which is safe. You don't have to. You have to take thinners, but an aspirin suffices. You don't have to take a warfarin or heavy dose thinners. But what happens is it doesn't have durability or longevity. It can give you 10 years, 12 years, 15 years. But then the tissue valve wears out. What you need to do is you need to do your echos on time. You need to do echos every 6 monthly now, because 2013, it's almost 10 years. So 6 monthly 2D echo to see the functioning of the valve, whether there is any leakage developing or not, whether there is any stenosis. And nowadays there are fantastic, I told you TAVI is what we do, transcatheter aortic valve. So I have a patient right now admitted in Wokhar Hospital, wherein she's an 84-year-old lady who's undergone a tissue valve, and now she's already an open heart surgery was done. She's 83. She cannot do a redo. That is, you cannot open up the heart again. So I'm going to perform this procedure now. I'm going to put a valve inside a valve, and that will take care of the degenerative changes which happen in the valve. So TAVI is the therapy. If at all you require, by God's grace, you should not require it. But if you require it, then TAVI is the therapy to go about. You can put a valve inside a valve without opening the heart.
Doctor, we are nearing our end time, but I'll just keep 2 questions. One is, Zarina Masalawala asks, what does RBB bundle mean in a cardiograph?
Okay, so RBBB means right bundle branch block. It has nothing to do with your blockages of the heart. The blockage might be present, may not be present. That it does not tell you anything. 4% of regular individuals will have RBBB on the ECG. What it means is there is this bundle, which the pacemaker, which I told you, the pacemaker has a heart is a wired system. So the wire from the pacemaker, which is the upper chamber of the heart, comes down and then branches into the right bundle and the left bundle. So these are the electrical wires. This is nothing to do with the blockages. So some individuals don't have this right bundle. And because they don't have this right bundle, there is a particular pattern which is seen in the ECG, and that's called as a right bundle branch block. What people confuse is an RBBB means there is a blockage in the heart. It's not the blockage in the heart, but it's a blockage in the wiring system of the heart. So that ECG pattern is there, which can be normally seen in 4%. If you just have an RBBB, you are asymptomatic, you have good cholesterol and sugars, it could be normal. It could be normal for you. And one more thing I want to impress upon before I leave, and it's very, very important, is keep your medical records very, very well. So RBBB, I see a lot of patients with RBBB, and then they have some pain here and there, and which I know maybe this RBB is normal for all. But there are certain people who have done an ECG before. And if I get an ECG done before and I compare both the ECGs together, I see, this patient had RBB 10 years back, the patient has lived for 10 more years. This RBB is normal for this patient. So this is very important to keep your medical, because what people do is they throw their medical reports out. हो गया दिवाली की साफ सफाई हो गई, Christmas की साफ सफाई होगी, बाहर निकाल दिया. No, it's a gold mine. It's so much of information for the doctor. You are helping us. And what we nowadays do is, what I ask my patient is, take snapshot of all the reports and don't keep it on your phone. Make a folder in Google Drive. Upload everything on Google Drive. So if you lose your phone, if you go out on a party or a holiday outside and you don't have medical records, you have it on your phone. You have it on your drive. So medical record keeping is very, very important.
Right. Thank you. We have one last question, which is a very broad-based question, is that what are the kind of things that you need to do for keeping your heart walls healthy? This is Zareen Shawfas.
Unfortunately, I could tell you everything. I could tell you, do this, do that. But unfortunately, nothing has helped. But yes, what helps is what I feel. This is not science, but what I feel, and this is from experience. This is not any study. It's good food, fresh air. This is for all. So eat good food, have fresh air, exercise regularly. All these things will keep you healthy, will help you live longer. So also, what people do is they don't have a regular exercise routine. A lot of patients, they just skip. What the ACC tells you by recommendation to keep a good physical health, do 120 minutes of exercise. Just 120 minutes of exercising in a week suffice. 120 minutes is just 2 hours of exercise. So just do 2 hours of exercising in a week's time. It could be any which ways, and it will take care of your health. You might not lose weight, mind you, but it will keep a good physical health. So exercise regularly. Also, some amount of weight training also helps. So some amount of weight strengthening. It is not 50 kilos, maybe 2 kilos, maybe 3 kilos. For some people who are not the 70 plus, but 60 odd, helps you keep your muscles toned, and keeps what happens in the basal state. Also the muscles consume your cholesterol, they consume your sugars, and that keeps you healthy. So basic small weights, keep yourself active, eat good food. These are all the things which are good for a healthy heart. But unfortunately, if you ask me specifics, like I give you specifics for blood pressure, low salt, I give you specifics for a weak heart, that is low salt, low water. I give you specifics for keeping your blockages out. There's no specific for keeping your walls normal.
Thank you, doctor, for taking so many questions that we've been able to address today, and answering all of them, so in such a detailed manner. Thank you very much once again for your time today, and we'd love to have you once again. One other things, I hope our people don't have to come to you for help or anything. But,
please come to me.
I know you're always available, and we have given your number and your email address. For all of you here, thank you for being here. And as always, we will have the edited extracts from edited video, as well as the takeaways from this, written by a qualified doctor. And these will be up on seniorstoday.in on Monday. We will be back once again next week, next Saturday, on for our next session of Health Live at Seniors Today. Our next issue of Seniors Today is going to be out on the 15th. We have, as you're aware, the great singer Lata Mangeshkar passed away last Sunday, and the first issue, the very first issue of Seniors Today had an interview with Lata Mangeshkar, and it was perhaps her last extensive interview that she had conducted, that she had given. And we have a story around that, and we have a special tribute written by Mr. Harsh Goenka to Lata Mangeshkar, and because the family knew her fairly well. And yeah, that's about it. I'm looking forward to the issue, which will be out on the 15th. There's a fair amount of interesting stuff that is there. There's this article. So we have Harsh Goenka writing on Lata Mangeshkar. There's Urvi Piramal writing on Badami caves that exist in Karnataka. There's an article by Vandana Kanoria on Mehendi. There's something on Jethro Tull, if you are interested in Jethro Tull music. So a lot of it is there, and so look forward to it. It's there. It will be there on seniorstoday.in on the 15th. That is Tuesday. So with all our love, it's Valentine's Day coming up on Monday, February 14th. So all the best for you, and let's meet once again next Saturday at 5 p.m. Thank you once again, Dr. Ankur. I think I have to look at you like this, but right. Thank you. Thank you very much, Dr. Ankur. Thank you. You are on mute. You are on mute.
Thank you very much. Thank you. It was nice being here, and I hope to come back again to take your questions next time.